What's up, everyone? This section here, what we're going to be covering is AIL Plus. We're going to go over what it is, what it does, and really what that does for your client, what it does for you, and like how it's used in the presentation. So let's start out with a little bit of a background. Okay, so American Income. So for years we had something called American Income Partners. All right. And American Income Partners, what that was, it was basically like a discount plan, a discount program. It was almost like AAA, right? The thing is, it's not AAA, right? So the network wasn't quite as big. So people could still save some money on some out-of-pocket health services, but there wasn't quite as extensive as something, like I said, like AAA would be. Now, AIL Plus is new as of like spring 2020, all right? So the company they went back to the drawing board and they basically doubled down. They put a whole bunch of money into it, a lot of research and development and everything. They made a program they took a program that was already good and made it so much better by like several orders of magnitude. So it's not like a pamphlet or anything like that anymore. What it is, it's just an app on your phone. That's it. There is no paper version or anything. It's just an app on your phone. We're well into the 21st century now, and electronic is the way to go. So it's just an app on your phone. All right, and it'll save you. It saves people anywhere from 10 to 85% discounts on all kinds of stuff. They'll get discounts on prescription services. They can get discounts on vision. That's not just glasses, but that's also eye exams, contact lenses, hearing aids, hearing aid batteries, hearing exams, all of that stuff. Chiropractic care, even things like dental, which is kind of new. All right, so a good example of how this would work is, for example, with dental insurance. A lot of dental insurance, it'll cover a lot of like named procedures, right? So people that have dental insurance, they're like, oh yeah, that's covered. It'll cover a lot of named procedures, but what it doesn't necessarily cover is the entire cost of that procedure. So a good example of this would be like a crown. Crowns a lot of times are about $2,000. So there's $1,000 that is covered by your dental insurance, and then $1,000 that you, that's the customer, are paying out of pocket. This is what that would apply to, is that $1,000 out of pocket. All right, and they can save anywhere from 20 to 40% on dental alone. Okay, now how this actually works for you. So AIL Plus, the way it works is they get push notifications. So after they've been a member of it for a year, they're going to get push notifications saying that it's time to renew their membership, and they're also going to have access to different programs, so on and so forth, and they need to be contacted by a local representative, and that they will be contacted by a local representative. All right, so they're going to get these push notifications about that, which means that 12 months after they're enrolled in AIL Plus, they're going to turn into a lead again, which allows us a kind of a unique opportunity. Because sometimes we'll meet with a family, and everything that's going on in their life, they need our services, but for whatever reason the timing just isn't right. So this allows us to follow up with that family 12 months from now, because they're now a new lead in our database. All right, now let's talk about what you actually have to do as the representative to make sure that this is all done properly. Okay, so in order to make sure this is all done properly, you have to make sure that that number one, when you're going over this with them, make sure that they download the app. Okay? Number two, when you get into the needs analysis survey, there's a spot at the top of the needs analysis survey, and I'll put that right here, all right, that's going to show their name, their birth date, address, so on and so forth. Okay? You have to and want to fill that out properly. All right, so you want to make sure you put all the correct information in there. And one spot that people get lost on is if for whatever reason the client that you're sitting with does not have an email address, and they should, but if they don't have an email address, all right, you're going to put no email at ailife.com. Again, no email at ailife.com. All right. So what will happen is they're going to get, once you fill all that information out in the survey and everything, whether it's a sale or not, automatically, about 2 days afterwards, they will get an email from home office allowing them to enroll in AIL Plus if they choose to. All right? They'll get an email explaining how to do it, the website to go to, what it covers, a little bit more, so on and so forth. And they'll have all that right there. And then once they're enrolled in it, the app will activate, and they can use it for whatever they want to use it for, and they can even search by zip code for what's near them. All right, and then in 1 year, that's going to turn into a lead. Now, my recommendation to yourself is download the app yourself, AIL Plus. All right, that's the word plus, not the plus sign. All right, download the app yourself, and then what I'll do is I'll include we'll include in the captions the link where you can register for yourself. We'll include that right here. All right, so that's what we're gonna do is have you log in for yourself, register it, and check it out on your own. And that way, you might even be able to save some money yourself. All right, and on top of that, you're also going to have a good understanding of how it works, because this is a no-cost program. Doesn't cost them anything. Can't help but check it out. All right, see you in the next one.